tPA is used in vascular surgical patients to treat embolism and thrombosis. tPA is contraindicated if the patient has had a stroke, head trauma, or intracranial surgery within the last 12 weeks, or if an intracranial hemorrhage is suspected or demonstrated on CT. Other contraindications include an aneurysm, arteriovenous malformation, blood pressure above 185/110 despite treatment, active bleeding, known coagulopathy, well-developed ischemic infarction or neoplasm, a platelet count less than 100,000, an INR greater than 1.7, anticoagulation within 48 hours, prior history of a reaction to tPA, or infectious endocarditis or septic emboli. The patient's vital signs should be measured every 15 minutes for 1 hour, every 30 minutes for 2 hours, and then every 2 hours. The RN should check the catheter site for hematoma with each set of vitals, as well as a general assessment of the catheter extremity, including distal pulses, temperature, and neurological function. The patient's CBC, fibrinogen levels, and PTT levels should be monitored every 6 hours throughout therapy. Patients on thrombolytic therapy should be kept on strict bed rest, and manipulation of transducer or infusion line should be kept to a minimum. The RN should not change the dressing of the infusion line. Needle sticks should be avoided during tPA infusion, including sheath insertions, intramuscular injections, or subcutaneous or arterial sticks. There are 2 concentrations of tPA available for vascular thrombolytic therapy. 10 mg of alteplase should be mixed in either 250 or 500 cc's of normal saline. Several infusion rates are available in the care set at the physician's discretion. Notify the physician immediately if any complications are present. Assess for any signs of bleeding throughout therapy. Arterial and venous punctures should be checked frequently. A headache is an early warning sign of a brain bleed. Stop the tPA infusion immediately and notify the physician for sudden decrease in level of consciousness, headache, nausea or vomiting, new neurological deficits, evidence of bleeding or lip swelling, or evidence of an allergic reaction. Notify the physician for a hemoglobin drop of more than 1 gram in 6 hours, any change in peripheral pulses, temperature, or neurological status of the catheter extremity, or a fibrinogen level less than 150. It is critical to monitor fibrinogen levels at regular intervals throughout tPA therapy in vascular patients. Low fibrinogen levels indicate decreased coagulability and increased risk for bleeding. High fibrinogen levels indicate increased coagulability and may be associated with increased risk for thrombus formation.